European aid flights had been put on hold for weeks because of the ongoing coronavirus lockdowns. But for the first time since the pandemic started, an aid flight has left, taking coronavirus supplies and medical workers to the Central African Republic. Well, our reporter Guillaume Petit was at Lyon airport to witness the plane's departure.
The silence that had prevailed on the tarmac of the airport of Lyon was broken, the plane ready to welcome 75 humanitarian workers from 12 nationalities. With more than 8 tons of medical equipment on board, they will fly to Bangui in Central African Republic. This is Europe's first humanitarian airlift to Africa, providing masks, gloves and medicines to fight the COVID-19 pandemic. After years of internal conflicts, COVID-19 is causing more damage to the health system anyway under severe strain.
Basically, we have a really weak health system, so the importance of really being informed on how to be protected is really key. And to do that, well, we need all the humanitarian workers, all the social workers to be able to go in the communities to explain to people what to do, how to protect themselves.
Further flights are planned for the Central African Republic as well as Burkina Faso and South Sudan, all coordinated by NGOs and with contributions from 10 European countries. Solidarity being shown towards neighbours that was in short supply across Europe itself at the beginning of the pandemic. Euronews spoke to the EU Commissioner for Crisis Management.
Yes, we did face some problems during the initial stages of the outbreak in Europe, but those problems had more to do with the lack of personal protective equipment than the lack of solidarity. Once the situation with the personal protective equipment improved, the solidarity resumed. Now it is displayed, so to say, daily. The member states are helping each other with the equipment, with doctors, with taking patients to the hospitals.
More solidarity, but also more obstacles. According to NGOs, there's more and more competition because states and NGOs want the same medical equipment. Flights are more rare and borders have closed or remain closed.